Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
Types of OCD. Why compulsions are not always visible. Most people picture obsessive compulsive disorder, OCD, as washing hands too often or checking a lock repeatedly before leaving the house. That picture isn't wrong, but it's incomplete. A lot of what OCD looks like happens quietly, inside someone's head, where nobody else can see it. Understanding the different types of OCD starts with recognizing that a compulsion doesn't have to be something you can watch someone do. Why OCD doesn't always look like OCD. According to the NIMH, obsessive compulsive disorder can involve obsessions, compulsions, or both. Obsessions are unwanted thoughts, urges, or images that cause real distress. Compulsions are the response, something a person does either outwardly or in their own mind to ease that distress or prevent a feared outcome. That distinction matters because compulsions do not have to be visible. DSM-5 criteria include mental acts such as silent counting, praying, or repeating words internally, often according to rigid rules. Compulsions rarely feel good. At most, they bring brief relief. They become clinically significant when they take up substantial time, cause significant distress, or interfere with work, school, relationships, or other parts of daily life. The types of OCD and where they hide. There isn't a separate obsessive compulsive disorder diagnosis for every subject someone obsesses over. A large clinical review found symptoms reliably cluster into 4 broad dimensions, and many people experience more than one at once. Contamination and cleaning. Compulsions may involve repeated washing, cleaning, or changing clothes. They can also take less visible forms, such as avoiding contaminated people or places, asking someone else to touch something first, or mentally reviewing a possible exposure. Harm, responsibility, and checking. Doubt can send someone back to a lock or appliance they already checked. It may also lead to reviewing past events, asking the same question again, or avoiding decisions completely. Symmetry, ordering, and just right feelings. For some people, a crooked object or unfinished feeling is hard to leave alone. They may adjust it, repeat what they just did, count quietly, or run through certain words until it eventually passes. Unacceptable thoughts and mental rituals. Compulsions may involve repeated confession, questioning, or avoiding certain situations. They can also happen internally through repeating a prayer or phrase, replacing an unwanted thought with a safe one, or analyzing its meaning over and over. Labels like relationship OCD or pure O can help someone describe their experience, but they aren't formal diagnoses. Hoarding used to get grouped in here too, but the DSM-5 now classifies it separately. How clinicians tell an obsession apart from a mental compulsion. This is harder to spot, since both the obsession and the response can happen entirely inside someone's mind. Mental rituals. Mental rituals serve the same purpose as visible compulsions. Someone might count silently, review an event, repeat a prayer to neutralize distress, or keep working through an argument until it feels settled. In a study of so-called pure O, Williams and colleagues found that mental rituals and reassurance-seeking were closely associated with this presentation. The compulsions could be overlooked because they were not always visible. Rumination versus obsession. An intrusive thought that arrives uninvited is part of the obsession, but deliberately debating it to reach certainty can become the compulsion. The line isn't about where it happens, rather it's about purpose. Flexible thinking versus an urgent push to erase doubt. Checking turned inward. Checking works the same way. It's often pictured as walking back to a locked door, but it can also mean rereading a message for hidden meaning or checking whether a memory feels accurate. According to Birya and colleagues, repeating the check can weaken confidence rather than settle it, pushing someone to check again. Clinicians consider not only the thought itself, but also what the person does next to reduce distress or find certainty. Why reassurance and avoidance keep the cycle running? Two common but easily missed obsessive-compulsive disorder patterns are avoiding triggers and repeatedly asking for reassurance. Avoidance rarely looks like a ritual since nothing repetitive happens on the surface. Someone might stop going somewhere, hand a task to a coworker, or put off a decision indefinitely. Previous estimates suggest that up to 59.7% of people with OCD engage in OCD-related avoidance. Reassurance-seeking runs on the same engine, repeatedly asking a partner or family member to confirm nothing bad happened, a task was done correctly, or a thought doesn't reveal something about who they are. Relief rarely lasts, so the question returns, sometimes reworded. Loved ones often help by answering or adjusting routines around triggers. That support is understandable, but researchers call it family accommodation, and it can reinforce the cycle it was meant to ease. These patterns get missed for practical reasons too. Someone might feel anxious or indecisive without recognizing the ritual underneath it. Mental compulsions can look like ordinary problem solving, and reassurance can sound like normal conversation. Many people also stay quiet about intrusive thoughts because they fear being judged, which is one reason why OCD can be difficult to diagnose. How treatment for OCD reaches the rituals you can't see. Treatment for OCD usually starts with a careful assessment of triggers, obsessions, visible and mental compulsions, avoidance, and reassurance-seeking. A Department of Defense evidence brief describes assessment, education, and collaborative treatment planning as the first stages of ERP. Exposure and response prevention, or ERP, is a specialized form of cognitive behavioral therapy and one of the leading treatments for OCD. Exposure involves gradually approaching a situation, thought, or uncertainty that triggers distress. Response prevention focuses on not performing the ritual that normally follows. When the compulsion happens internally, treatment needs to address that mental ritual too. The evidence for ERP is strong, although some people remain symptomatic and treatment still needs to be tailored to the individual. Medication is another established option, and SSRIs are used most often. They can take several weeks to begin helping. People whose symptoms have not improved with standard treatment can discuss additional options with their provider. Naming what's been invisible. Once you can name a mental ritual as a mental ritual, or reassurance-seeking as reassurance-seeking, it stops feeling vague and starts being something you can respond to differently. Recognizing the different types of OCD, especially the ones nobody else can see, is often the first step toward change. If any of this sounds familiar, Zeam is here to help you make sense of it. Reach out to our team about treatment for OCD built around your whole picture, not just what's visible. As always, thank you for listening to More Than Medicine by Zeam Health. Next week, we will be discussing PTSD treatment options, how different approaches support recovery. Until then, have a great week.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.